Hey, my name is Jody Trevine, and welcome to my TED Talk. Today, we will be rethinking conduct disorder in Black boys. So, imagine being 8 years old and already being considered a problem. Talk too much in class, you can't sit still, or laugh at the wrong times. Before long, your teacher stops seeing you as curious, they see you as disruptive. This story is unfortunately common, especially for many African American boys. The classroom the classroom becomes the first courtroom. I've seen it firsthand. Children who are smart, vibrant, slowly begin to believe that what the world tells them, that they are trouble. This talk is for those boys whose behavior is normally misunderstood, whose pain is misdiagnosed, and whose stories deserve to be heard. So, what is conduct disorder? Um, Conduct disorder sounds harsh, right? It's defined as aggression, deviance, or breaking rules, but behind those words are children navigating environments filled with stress, survival. What looks like bad behavior is often emotionally exhaustion. It's the boy who fights because he doesn't feel safe. Uh, the one who lies because trust has never been consistent, the one who shuts down because it's the only power he's ever had. These are not bad kids. They are hurting kids reacting to broken systems. When we only treat behavior, we ignore the message beneath it. So some key symptoms would be aggression toward people, animals, property, destruction, lying, or stealing. um Typically before the age 10, and it can lead into adolescence. The consequences are normally like school suspensions, expulsions, juvenile justice involvement, or social isolation. Cultural misunderstanding. The culture lens we often miss. Research shows American boys are often suspended or expelled up to 4 times more than their white classmates. Teachers may see confidence as them being defiant or frustration as aggression. Biases doesn't always look like hate. Sometimes it looks like misunderstanding. The same behaviors that spark empathy in one child spark punishment in another. When discipline replaces understanding, we push children out instead of pulling them in. The truth is, these boys are not being bad, they're being human in systems that refuse to see their humanity or struggle. Complexity behind the behavior, excuse me. If if we want to understand conduct disorder, we have to look at what's underneath it, right? Poverty, community violence, absent fathers, stress filled homes, a world that tells young boys to be strong but never soft. These boys learn early that emotion is weakness, so anger becomes armor. What looks like resistance is actually resilience. Acting out isn't always deviance. Sometimes it's survival. Every behavior is a story, and when we listen closely, we find a child who just wants to feel safe. Environment factors, like I said before, would be poverty, exposure to violence, family instability, community influences, limited access to mental health resources, and supportive adult figures, emotional and cultural layers, mistrust of systems need to appear mistrust of systems need to appear tough, racial trauma, misdiagnosed risk. Clinicians may overlook trauma or depression that manifest as anger. Theoretical framework. Ecological systems theory reminds us that no child exists in isolation. A boy's behavior isn't shaped in a vacuum. It's formed by family, school, peers, and environment around them. Uh, Add to the trauma informed care, and the picture becomes more clear. Instead of asking what's wrong with him, we should ask what happened to him. That small change in language transforms how we see, respond to, and ultimately heal. We approach behavior with empathy instead of judgment. We start treating the wound instead of punishing the symptom. Excuse me. Ecological systems theory, children's behavior is shaped by multiple systems: family, school, community, and culture. Trauma informed care emphasizes safety, trust, empowerment, and understanding trauma responses. Application recognizes how social inequalities and discrimination influence emotional development. Emerging intervention. Healing begins at home. Culturally responsive culturally responsive therapy is a bridge back to connection. It's about rebuilding relationships between parents and children who have been torn apart by misunderstanding and pain. This approach honors cultural identity. It welcomes spirituality, community, and family pride into healing process. As Breland Noble Bell and Nicholas 2006 reminds us, families aren't the problem. They're the pathway to recovery. When families communicate with love, when their children see their parents understand their struggles, therapy stops feeling like treatment and starts feeling like home. So the purpose of culturally responsive therapy is strengthening communication and attachment within African American families. The focus area is to rebuild parent and child trust, addressing intergenerational trauma, incorporating family and cultural strengths, and core principle: the family is not the problem; it's a part of the solution. The secondary approach. Healing in schools. Schools can be powerful places of healing when we go from cultural to when we go from control to compassion. A trauma informed classroom prioritize safety, empowerment, and giving their students a voice. Imagine restorative restorative circles instead of detention. uh Mentorship instead of punishment. Teachers who see crying not as weakness but as courage. When an educator says what's going on instead of what's wrong with you, that child learns something life changing. I'm safe here. um Trauma informed school intervention. The content framework: safety, trust, collaboration, uh empowerment. Strategies: restorative justice circles, mentorship programs, teachers training on impact biases, de-escalation and emotional regulation, skill building, outcome reduced behavioral referrals, and improved academic engagement. Research and evidence based. Research backs up what compassion already knows. William and Adams 2013 found that culturally adapted cognitive behavioral therapy reduced aggression in African American youth by nearly 40%. Goplan and colleagues 2014 showed that family based programs improved communication, reduced behavior issues. Stevenson 2014 demonstrate that racial literacy training helps students and teachers shaping bias with empathy and awareness. When we meet culture with care, outcome improve not because of discipline but because of belonging. Reliability, validity, and limitations. The progress is real, but the gaps are glaring. Too few students include African American boys or use cultural sensitive tools. Most assessments were designed with white middle class norms in mind. We need community led research, not just university led studies. We need to include voices of families, schools, and children themselves. You can't heal what you won't study, and you can't study what you refuse to see. Okay. Cultural adaptation and clinical appropriateness. As a social worker and mental health professionals, we have to lead with empathy, listen more than you talk, reflect on your differences, be curious, not judgmental. Our jobs is not to fix families, it's to walk beside them. Healing starts the moment a child feels seen and believed. The most powerful skill you can have in this work isn't in a textbook, but it's humanity. Aligning practice, use cultural familiar language, symbols, and family rituals. Include include community mentors and male role models. Integrate Afrocentric values, collectivism, resilience, and respect. Avoid harm. Be mindful of historical mistrust of healthcare systems. Acknowledge structural racism in assessment and treatment. Clinical skills for professionals. uh Empathy and active listening create safety before correction. Culturally humanity, commit to lifelong learning about racial identity and bias. Treatment fa- Family collaboration, treat families as partners, not problems. Reflective supervision, regularly assess how biases influence discussions. So let's take action, right? Let's rewrite the story. See the child before the behavior. Listen before labeling. Respond with compassion before correction. These boys are not broken. They are becoming when we look past the behavior and see their humanity. We don't just change their outcome, we change the entire system that failed them. Healing begins the moment understanding replaces judgment. That's where hope starts. So we can change the narrative. See behavior as communication, not defiance. Prioritize cultural competence and trauma informed care. Challenge systems that criminalize childhood. Avoid of Advocate for equity in schools, and mental health services. And that's about it for my TED Talk, guys. I hope that you enjoyed what I had to say and the message beneath it. We do need to rewire our brains and reapproach the bigger picture here instead of looking surface level. I feel like if we do the work, we can make a big adjustment. We can make a big difference in this society. And that's all I have for you guys today. And I hope you enjoyed my TED Talk.